Hello, everybody. My name is Dr. Sarah Wooten, and I am a small animal veterinarian. And in this video, I'm going to be talking to you about a very important topic, a potentially life-saving topic about your cat. We are going to be talking about urinary blockage in cats, the top 10 signs, and what you need to do. So urinary blockage is a common problem in cats. It's especially common in male cats. While we have seen urinary blockage in female cats, 9 times out of 10, it's a male cat. And it's because of their anatomy. Their urethra, which connects the bladder to the penis, is longer, it's thinner, and they have a lot more opportunity for places where things can get stopped up. And some of the most common reasons why male cats will get a urinary blockage is they either have a mucus plug or a stone that blocks the urethra, prevents them from peeing, and then boom, they are in big trouble. So it's really important to know the signs early, because if you catch this problem early, you can help your cat not suffer as much, because this is an extraordinarily painful condition. You can potentially save your cat's life. Right? And then thirdly, and a lot less important, but still important, is you can save a lot of money. Urinary blockage, when male cats get blocked up, they are hospitalized, often for days, and they have a urinary catheter in, and it's a whole hoorah and a half. So if you, the pet parent, can learn what to notice ahead of time, then you can often skip all of that necessary hoorah that's needed to save your cat's life if they become blocked. All right. First of all, we need to talk about signalment. Signalment is just my fancy vet way of saying, what is the cat? Is it a boy? Is it a girl? Is it a domestic short hair? Is it a Siamese? How old is it? Is it spayed? Is it neutered? Things like that. So a signalment of a cat that would be blocked would be male. They're often neutered, and they're in between usually 1 to 10 years of age. I mean, that's a lot of time. The first sign, number 1, straining to urinate. So straining to urinate, what does that look like, right? So that means that the cat goes in to the litter box and is there for a long time and not much happens, right? Or they go in there and they try to urinate, and maybe they vocalize, or maybe they run out really quickly. So cats, if they're in the litter box and they're trying to urinate, and maybe they're trying to urinate, but then there's just dribbles coming out, just drops, or maybe the stream is less than it usually is, that's the number 1 sign. Okay. So if you see that, that is the time to call a vet, because oftentimes this can be resolved sooner, with less pain, less suffering, less money. Second sign, frequent small urination. So this looks like the cat going to the litter box more often and just doing little tiny urinations in there. So maybe you're seeing a bunch of little clumps where before you used to see one big clump. Okay. And again, these are the signs that we see in indoor cats. It's much more difficult to see this in an outdoor cat, because usually you don't see an outdoor cat going to the toilet, right? Because they're not letting you watch. But if it's an indoor cat, and oftentimes these are indoor cats that are becoming blocked, frequent small urination is the second sign. The third sign, bloody urine, discolored urine, brown urine, red urine, streaks of red in the urine. So maybe you go and you clean out the litter box and you see something that looks like blood. That could be a sign that your cat has inflammation, at least in the urinary tract, and it could lead to a urinary blockage. So that's the number 3, blood in the urine. Number 4 sign that could signal a urinary blockage, a partial blockage, or an impending blockage. Inappropriate elimination. Urine, it's usually urine, but urinating someplace other than the litter box, on the laundry, on the bathtub, on the bath mat, wherever. That is often a sign that something is inflamed and painful and is stressing the cat out, and they're trying to tell you that it hurts. So that's my number 4. inappropriate elimination. Number 5, excessive licking or grooming of their nether regions. So if you are noticing that your cat is licking a lot back there, and it's more than usual, and maybe it's in combination with some of these other signs. Licking, it's a lot back there itself is usually, by itself is not usually a sign, but if it's in combination with these other signs, could be signs that there is trouble in paradise and you need to get a vet involved. My number 6 sign is the big one. This is the big one. This is the do not pass go, do not collect $200, go straight to your vet. And that is straining in the litter box without producing any urine. So they go in there, they posture, and nothing comes out. So once cats become completely obstructed, then they attempt to urinate in the litter box, but then they do not produce any urine. Just so you know, complete obstruction of the urinary system can cause these cats to go downhill very quickly. And I've seen these cats go from normal and healthy to death's door in less than 3 to 6 days. So if you see this one, you take that cat to the veterinarian immediately. If it is in nighttime, you take the cat to the emergency clinic immediately, because that could be a life or death situation. The next sign is so these next signs that I'm going to show you, tell you about, are the ones that cats exhibit after they've become completely blocked. And one of them is feeling a mass in the abdomen, in the back part of the abdomen, that feels hard. So when a bladder gets blocked, it's just a water balloon that fills up, but it's going to continue to fill and fill and fill because a cat keeps making urine until it can't anymore. And when it gets really big, it can be the size of a softball and it can feel that hard. Very painful, very dangerous for a cat, because that cat is at risk of bladder rupture. So if you are petting your cat or your cat's laying on their side and you notice some sort of mass effect in the back there, something hard, something circular in the back part of the belly and between the back legs, that is a sign of a possible urinary obstruction. The next sign is crying, restlessness, or hiding because they are uncomfortable. So cats will hide when they don't feel good. And this is very, very, very uncomfortable. So you could notice that your cat is pacing, they are crying, they just are not comfortable. So if you're noticing those signs, especially in conjunction with any of the other signs, could be a sign of urinary blockage. Number 9. So these signs are the cat is starting to get sick, because what happens if they can't urinate, toxins build up in the blood and then they get electrolyte derangements. So loss of appetite and vomiting can also be a signal that something is going on with a urinary obstruction. Regardless, if your cat is not eating and vomiting, you need to get that cat to a veterinarian, but it also could be signs of a urinary obstruction. And the last sign is extreme lethargy. So cats, when they get very sick from a urinary obstruction, they become very, very tired. In fact, they may not respond to their names being called at all, and they look kind of zoned out. So again, these are all really important that you pay attention and get veterinary attention if you see these signs. So the cats that have increased risk for this are cats that only eat dry food, they're kept indoors, they're overweight, they are in a multi-cat household, they have stress, and maybe they're nervous or fearful or aggressive. And also the incidence of this is higher in the winter months, which we're coming up to winter here. So I want you guys all to be on the vigilance and call your veterinarian if you ever see any of these signs. So that is all I have on this very important topic. I hope this is helpful. Hopefully this will help you save your cat's life because you know what to do. Thank you so much for watching. I am Dr. Sarah Wooten, and I will be back soon with another video for you.